Hello everyone, here's the content that is going to go with your Skype meeting that we'll have when classes resume. So I'm going to go through the PowerPoints for Chapter 15, which is Critical Thinking in Nursing Practice. So critical thinking or clinical judgment is an essential skill that involves interpretation of patients' needs, concerns, or health problems, and the decisions to take action or to not take action, to use or modify standard approaches, or to improve new approaches on the basis of a patient response. Now, when we talked about creating our research problem and coming up with the ways that we were going to go about it, critical thinking is the basis of how you approach and look at those problems and make those determinations. So this is the basis underneath of how we think about those problems and look at those problems and find those problems. Nurses apply knowledge, clinical experience, and professional standards when thinking critically and making decisions about patient care. So this is how you go into a patient and look at everything that's going on with them and make decisions about how you're going to take care of them, help them, treat them on a nursing level. Not treat their diseases necessarily, but treat the symptoms and the things that those diseases cause, and hopefully help them to feel better and to be better. As nurses develop professionally, it is important to acquire critical thinking skills that allow you to face each new patient care experience or problem with open-mindedness, creativity, confidence, and continual inquiry. We're constantly asking questions to discover new information and to make critical thinking decisions. Critical thinking is acquired through experience, commitment, and active curiosity. We always have to be looking at things and asking questions, asking why does that happen, how can we do something about that. Critical thinking is not a simple step-by-step linear process that is learned in a short period of time. Unfortunately, this isn't something that we can just teach you. It's really something that you have to learn by practice and application. Now, clinical judgment in nursing practice. Registered nurses are responsible for making accurate and appropriate clinical decisions or judgments. That's not to say that other levels of nursing are not, but registered nurses are responsible for doing this in a leadership role. So as nurses, we have to learn to question, wonder, and explore different perspectives and interpretations to find a solution that benefit the patient. What that means really is that as an RN, we're directing technical personnel to perform certain aspects of care and report back any important observations to inform us. Our care techs, our CNAs, may be doing direct care for those patients, and we have to be able to make decisions and inform them about what to see, what to look for, asking them questions about what they saw or what they found in order to make good clinical judgments about that patient's care. We may not be able to do every bed bath, every vital sign, every hands-on piece of care, but we have to be able to direct our hands-on staff in a way that allows us to make clinical judgment. So it's very important for us to make appropriate clinical decisions in order to help direct our hands-on staff, because we as RNs have to be able to see the big picture clinically. As an RN, we rely on knowledge and experience when deciding if a patient is having a complication, and which calls for a notification of a healthcare provider, or if a teaching plan for a patient is ineffective, it needs to be revised. We have to make these decisions, and it's very important that we be able to gather that clinical information and then make those clinical judgments. When a clinical situation develops, an RN must learn to recognize it, interpret the meaning, and respond appropriately. So we have to learn to question, wonder, and explore different perspectives and interpretations to find those solutions. Each patient's health problem is unique and a product of the patient's physical health, lifestyle, culture, relationship with their family and friends, living environment, and experience. With experience, you learn to creatively seek new knowledge, act quickly when events change, and make quality decisions for patients' well-being. Nursing is rewarding and fulfilling, and correct clinical judgment can make it even more so. We learn how to make those judgments and then see those judgments be proved correct and see our patients get better. So, critical thinking. Let's watch a video about critical thinking, some definitions, connections to the nursing process, and benefits and levels.
Critical thinking is an essential skill for nurses to develop. This video aims to define critical thinking. We will review how it connects to the nursing process, benefits of critical thinking, and levels of critical thinking. Then, in part 2 of this video, the components of critical thinking and ways to develop it will be suggested. There are many definitions of critical thinking in the literature. It is a complex process involving the purposeful use of logic, reasoning, and reflection, as well as cognitive skills and effective disposition that will be explored later in this video. As Potter and Perry indicate, critical thinking is more than just problem solving. It is an attempt to continually improve how you apply knowledge when faced with problems in patient care. It is the active, organized cognitive process used to carefully examine one's thinking and the thinking of others. Critical thinking draws upon skills used in other ways of thinking, but is viewed as a broader concept that is differentiated by its holistic, purposeful, reflective, and goal-directed nature. Critical thinking is central to quality nursing practice. Decision-making in nursing must not be hasty or ill thought out. Critical thinking is a standard for competent nursing practice. Nurses use critical thinking to anticipate client needs, incorporate knowledge from other disciplines, work in complex environments, and deal with change in stressful environments, all while making important clinical decisions and judgments about client care. Nurses use critical thinking in every step of the nursing process to analyze patient data within unique contexts, recognize patterns, form diagnoses, then plan, implement, and evaluate client care. It is important that nurses purposefully use and develop their critical thinking ability in order to deliver safe and effective client care. One model of critical thinking that is taught in many nursing schools separates it into 3 main levels: basic, complex, and commitment. As a novice student, you start at a basic level. As your critical thinking components develop, your level of critical thinking will move from basic to complex and commitment. Let's take a look at each level. At a basic level, you trust that experts have the right answer for every problem. Your thinking is more black and white, as you think there is a right way and a wrong way to approach each situation. Thinking is based on sets of rules or principles that you follow. This level kind of reminds me of the elementary school child who is convinced that their teacher knows everything, even if their mother and Google disagree. As a nursing student, you will likely follow hospital procedures step by step without adjusting for unique client needs the first time you do a procedure, like a dressing change. You will want to do everything by the book, or exactly as your instructor tells you. As you gain knowledge and experience, your thinking will become more complex. With more nursing experience, you will start to think for yourself and analyze situations on your own. This separation from experts comes with the recognition that there may be more than one way to solve a problem, which is what differentiates it from a basic level of critical thinking. The book may tell you to position a client one way, but you are now able to analyze the situation, take into account client preferences, and be more creative in the way you approach the situation. You still follow routine procedures, but in complex situations, you consider other options and discuss them with others. At a commitment level, you do more than just consider alternate options. This level is all about action and accountability, which is what differentiates it from complex critical thinking. You are able to independently anticipate the need to make decisions. You are making your own decisions informed by your knowledge and experience, and you stand by them. Since you are accountable and responsible for your decision, you pay more attention to evaluating the outcome to inform future practice. For example, when I decided to offer a Facebook group for interaction with students, despite objections of more senior faculty, that demonstrated a commitment to my decision that I believe supports students and educational pedagogy. To evaluate this action, a survey, video interviews, and publication were produced. This evaluation was prompted by my commitment to this decision. Pause this video for a minute and try to label each nurse according to the level of critical thinking they are using. Welcome back. Here are the answers. Sarah is questioning current standards. According to our model, this nurse is a complex critical thinker, since there is no indication that the nurse has taken any action or assumed responsibility for her decision. Jeff is trusting experts, which is characteristic of a basic level of critical thinking. Kyle is making and taking responsibility for his own choices, which makes him a commitment level critical thinker. Julie is following a step-by-step process without adjusting to client needs, which is characteristic of a basic level of critical thinking. If you disagree with any of these, please review the levels of critical thinking again and post a comment so we can talk about it. It is good to start questioning what you are told. It means your critical thinking is becoming more complex. For more, you can subscribe, visit my website, and click on videos of interest on this slide. Click on part 2 of this video to find out more about the components of critical thinking and how to develop it. Thank you for watching.
All right, so Nurse Killian has told us about the levels of critical thinking and how they relate to the nursing process. So let's move on to the next slide. Hello. Maybe. I know. Ha, there we go. And we'll look at part 2 of her critical thinking video entitled Components and Development of Critical Thinking.
Critical thinking is an essential skill for nurses to develop. In part 1 of this video, we defined critical thinking. We reviewed how it connects to the nursing process, benefits of critical thinking, and the levels of critical thinking. In part 2 of this video, the components of critical thinking are reviewed and ways to develop it will be suggested. In Potter and Perry, they go into detail about the components of critical thinking in nursing. These components are essential to inform the clinical judgments that nurses make on a daily basis. I think it just makes sense that in order to make safe client care decisions, you need a sound knowledge base specific to nursing. Nurses draw upon information and theory from many areas to think holistically about client care. That is why you're studying so much now. Nurses also learn from reflection on their experiences. The more experience you have, the more you are able to make safe adaptations to textbook approaches to care. Experience helps your critical thinking evolve beyond a basic level as you seek further evidence to inform your actions, such as best practice guidelines and interprofessional collaboration. Competencies include necessary cognitive processes for making decisions about client care. Some are quite general, and you may already be familiar with them. Others are specific to clinical situations and nursing. Recall that the nursing process incorporates critical thinking in each step and is therefore considered a critical thinking competency for nurses. For further detail about these competencies, please see Potter and Perry, Chapter 11. Critical thinkers are truth-seeking, open-minded, analytical, systematic, self-confident, inquisitive, mature, disciplined individuals who admit to their own limitations. Attitudes are a very important part of being a critical thinker. How do you react when a client complains of anxiety? Are you curious? Or do you pass it off as normal? To make decisions, nurses also use intellectual standards or guidelines that promote thoroughness, precision, accuracy, and consistency in all client care. Professional standards relating to ethics, evidence, informed evaluation criteria, and professional responsibility are also key for informing decision-making. As you can see, there are a lot of things that influence your critical thinking ability. As your knowledge and experience develop, so will your ability to be a critical thinker. Always strive to demonstrate the characteristics of a critical thinker. Be curious, insightful, systematic, analytical, truth-seeking, open-minded, confident, and creative. You can move beyond a basic level of critical thinking by changing your attitude and questioning what you hear and see. Be inquisitive. There are other ways to develop your critical thinking skills. Start routinely reflecting on your practice. Reflection is necessary for self-evaluation and will help you develop. Purposefully think back and analyze what happened and how you reacted. Critical thinking involves framing of one's thoughts. Use clear and precise language to reflect your thinking. Notice any intuitions. Intuition is developed from experience in nursing. It is a direct understanding without conscious deliberation. It is important to confirm intuitions with appropriate clinical observations. Concept mapping helps you identify the relationships between concepts. It is a good way to visualize what is happening with your patient. It helps to train you to organize information in a way that forms meaningful patterns among data and gain a holistic understanding of the situation. Remember, critical thinking expands with experience. Keep working to change your approach to thinking, and be sure to question what you hear and see, even if you hear it from an expert. For more information about critical thinking, explore some evidence. These references may be a good starting point. For more, you can subscribe, visit my website, and click on videos of interest on this slide. If you haven't already seen part 1 of this video yet, be sure to check it out. Thank you for watching.
So, that gives you some really good components of critical thinking. So let's move on to our next slide, where we are going to talk about critical thinking and define it. So, critical thinking, the ability to think in a systematic and logical manner with openness to question and reflect on the reasoning process. Well, that's pretty much what Nurse Killian said. Because a critical thinker considers what is important in each situation. A critical thinker imagines and explores alternatives, considers ethical principles, and makes informed decisions about the care of their patients. Critical thinking is a way of thinking about a situation and always asking, why? What am I missing? What do I really know about this patient situation? And what are my options? One of the things that Nurse Killian said in the video was that the reason that you're studying so much right now is because as critical thinkers in nursing, we need that knowledge base. We need that information that we can draw on. And whenever you're looking at that situation and saying, what do I really know about this patient situation? If you don't have information, then you have to get information. Do I know about this person's disease? Do I understand this epidemic that's hitting us, this pandemic? If I don't, I either go to the experts or I become an expert by reading everything I can and getting all of my information. Understanding how does it spread? What do we know about the spread, and how do we protect ourselves? These are the things that we're doing right now as critical thinkers to protect ourselves as healthcare providers. If we don't know, then we go to the experts who do, and we see what their research says. And we inform ourselves to make good critical thinking decisions. So, as critical thinkers, we want to use our cognitive skills. Critical thinking requires cognitive skills and the habit of asking questions, staying well informed, being honest in facing personal bias, and always being willing to reconsider and think clearly about the issues, not letting our wallets overcome our good sense. Many of us are losing money at work, and we really would like to just go back to normal, but we can't, because we have to understand that critical thinking demands that we look at the situation without bias. So, recognizing that an issue exists, analyzing that information, evaluating information, and drawing conclusions. Always open-minded, inquiry, and a willingness to look at each unique patient situation and determining when to identify assumptions are true and relevant. And then reflection. Reflection is the ability to act on the basis of critical thinking, and that comes with experience. The ability to act on the basis of critical thinking comes with experience. Turning over a subject in the mind and thinking about it seriously is reflection. And reflection is not intuitive. The other thing about reflection is that reflection has to be done without bias. So sometimes reflection, we have to look at what we did, look at our actions and say, oh boy, did I mess up. I was so wrong in that situation. I really need to look at what I did and make sure that I don't do that again. Sometimes we have to look at what others say, their reflections on whatever happened, and say, yeah, they're right, I messed up. Reflection has to be done without bias, without allowing emotion to get in the way. And that's very important when we look at reflection. And sometimes very hard to do. We don't want to admit that we messed up. When we reflect, we may be looking at, how did I act? What could I have done differently? What should I do the next time in the same situation? And it's very important that we review our successes and opportunities for improvement without allowing ourselves to become defensive, without allowing ourselves to become angry, but looking at it to say, how can I improve by reviewing these things? Reliance on reflection can block thinking if you rely on it too much. So reflection is a good part of critical thinking, but it doesn't replace the thinking part. You always want to look at newer evidence and subtle aspects of a situation that you have not encountered before, but reflection is a good way to look back and improve your future performance. So here we've got a case study, and we've got Carla, a third-year nursing student, who is assigned to a surgical nursing unit, and Mr. Javier Ramirez is a 55-year-old construction worker admitted after falling off a scaffolding on a construction site. His x-ray films reveal a right femur fracture and right wrist fracture, an abdominal computed tomography, I always hate that, a CT, scan shows bruising on the liver. Mr. Ramirez has not been hospitalized in the past. When he first meets Carla, he is very quiet and asks few questions. So what do we know so far about the patient in this case study? So think about it. What reasons might there be for Mr. Ramirez to be so quiet and ask so few questions? What kind of responsibilities might Carla have when caring for Mr. Ramirez? So what do you think? Do you think that because Mr. Ramirez is very quiet and asks few questions, that he will be easy for Carla to care for? So how should Carla deal with this? Oh, this is an easy day. This guy's not going to say anything. So think about that. And we'll talk about this case study a little bit, if we have time, on our Skype call. And if you have anything you want to bring up about it, then we'll talk about it. But think about that. So the levels that Nurse Killian talked about, here's those levels of critical thinking. So we have our basic level of critical thinking, where you learn, where as a learner you trust the experts, and you believe that they have all the right answers for every problem. Your thinking is very concrete. When we talk about the levels of development, and you talk about Erickson and everything, that concrete thinker, that's that elementary school level child, that they're concrete thinking. That's why they have trouble with, they watch those movies where, nothing is black and white, nothing's right or wrong, it's kind of a gray area, and they're like, no, it's not. The superheroes, they're what they like because there's good ones and there's bad ones. You're either a villain or you're a superhero. And they like that because it's concrete thinking. It's based on a set of rules and principles. Basic critical thinkers learn to accept the diverse options and values of experts. They're instructors, staff nurse, preceptors. However, inexperienced and weak competencies and inflexible attitudes can restrict a person's ability to move to the next level. That's why we are trying to get you guys to get as much experience as you can, and when you get into clinicals, to learn your competencies, to have strong attitudes about how things, what should be done, best practice, and we try to teach you those and set you up to form a strong commitment to practice so that you can develop that in yourself and move into second level, which is complex critical thinking. And that begins to separate yourself from the experts. You begin to develop for yourself a strong personality as a nurse, where you have internalized those values and beliefs of the experts that you have learned from, and you can now stand on your own with some clinical judgment and clinical situations, and you can examine choice more independently. You can look at each solution that has benefits and risks, weigh those before making a choice, and you can make that choice based on your own clinical experience and begin to make those decisions. In that complex critical thinking, as each risk and benefit is weighed and you make a final decision, there are options. Thinking becomes more creative and innovative. As a complex critical thinker, you're willing to consider different options for routine procedures. When complex situations develop, you learn to gather additional information and take a variety of different approaches for the same therapy. So you as a nurse begin to learn how to develop your own clinical judgment. And then at the commitment level, nurses anticipate when to make a choice without assistance from others and accept accountability for those decisions. Hear that? That's the other component. When you get to that commitment level, you're not only making those choices on your own, but you are accepting that accountability, which is like responsibility for those decisions. If it's a wrong decision, you are accountable. If it's a right decision, you are accountable, which means you get the praise or you get the consequences. As a nurse, you do more than just consider the complex alternatives that a problem poses. The nurse chooses an action or belief that is based on, turn the page, available alternatives and support. Because they take accountability for decisions, nurses consider the results of the decision and determine whether it was appropriate. So, there's a critical thinking model for nursing judgment shown in figure 15.1 in your book. So that's really, when you get up to this highest level, that is really part of that responsibility goes with that choice and accountability. So here we're back at our case study again. Mr. Ramirez's leg is in skeletal traction and his right arm is in a soft cast. Carla decides that she needs to begin her care by assessing Mr. Ramirez and determining his health status. She begins by reviewing his medical history. She learns that he has a history of smoking and was diagnosed with type 2 diabetes just 5 years ago. So, do you think Carla is making the right decision to begin her care of Mr. Ramirez by assessing his health status? So, what do you think? So there's another thing that we'll bring up on Skype. So some critical thinking competencies. We've got general critical thinking, which is things like scientific method, which is a systematic, ordered and approach to gathering data and solving problems, which includes the 5 steps of identifying the problem, collecting the data, formulating a question or a hypothesis. Then you test the question or hypothesis. Then you evaluate the results of the test or study. And we looked at that when we were talking about research. In your book in box 15-2, there is a using the scientific method to solve nursing practice questions, so you can review that. Effective problems solving involves evaluating a situation over time. So when we talk about problem solving, identifying possible solutions and trying a solution over time to make sure that it is effective. It becomes necessary to try different options if a problem recurs. So if you try to solve a problem and you do something and then the problem comes back, you're probably going to try a different solution. So problem solving is one of the things we do in critical thinking. It's like, oh, we're going to try this. If that doesn't work, then we're going to try something else. And then decision making is a product of critical thinking that focuses on problem resolution. Following a set criteria help to make a thorough and thoughtful decision. The criteria may be personal, based on an organizational policy, or in the case of nursing, a professional standard. The person has to weigh each option against a set of personal criteria, test possible options, consider the consequences of the decision, and make a final decision. Decision making involves moving back and forth when considering all criteria. It leads to informed conclusions that are supported by evidence and reason. And then, as far as specific critical thinking, diagnostic reasoning and inference, and then clinical decision making. Diagnostic reasoning is the analytical process for determining a patient's health problem. Accurate recognition of a patient's problem is necessary before you decide on solutions and implement actions. It requires you to assign meaning to the behaviors and physical signs and symptoms presented by the patient. An expert nurse sees the context of a patient's situation, observes patterns and themes, and makes decisions quickly. Part of diagnostic reasoning is clinical inference, the process of drawing conclusions from related pieces of evidence and previous experience with the evidence. When making an inference, you form patterns of information from data before making a diagnosis. When you're uncertain of a diagnosis, you continue data collection. So, if they do a test on you and they're like, hey, that didn't tell us anything, we do another test. So you would continue your data collection. You have to critically analyze changing clinical situations until you're able to determine the patient's unique situation. So when we're doing diagnostic reasoning and inference, we keep doing that until we figure out what's going on, until we get enough data to tell us what the situation is. For clinical decision making, makes a decision that identifies the problem, reducing the severity of the problem, or resolving the problem completely. Skilled clinical decision making occurs through in-depth knowledge of the patient's patterns of responses within a clinical situation and knowing the patient as a person. It has two components: a nurse's understanding of the specific patient and his or her subsequent selection of interventions. So, to foster knowing your patient, spend more time initially in the patient assessments to observe patient behaviors and measure physical findings as a way to improve knowledge of your patient. Determine what is important to them and make an emotional connection. Patients perceive meaningful time as that involving personal rather than task-oriented conversation. When talking with patients, listen to their account of their experiences with illness. Watch them and come to understand how they typically respond. Consistently check on patients to assess and monitor problems to help you identify how clinical changes develop over time. Ask to have the same patient assigned to you over consecutive days. Researchers have noted that a nurse-patient relationship develops from getting to know a patient and building a foundation for connecting on the first day of care to deepening understanding of the patient and sustaining a connection by the second day to being comfortable with the patient by the third day. I don't think that happens a lot of places, but that's an interesting concept. Social conversation and continuity are important for developing knowing and nurse-patient relationships. Always keep a patient as your center of focus as you try to solve clinical problems. When you work in a busy setting, use criteria that include clinical conditions of the patient to manage the wide variety of problems associated with groups of patients. Skillful, prioritized clinical decision-making is critical. So those are the competencies that we want some of the competencies that we want to work on for critical thinking. A few more nursing competencies. These kind of, if they don't look familiar to you now, they're going to look familiar to you because this is the nursing process. And the nursing process is action-oriented. So these are competencies as well as our nursing process. So in box 15-3, the clinical decision-making for groups of patients with students, you'll see that. And then the purpose of the nursing process is to diagnose and treat human response to actual or potential health problems. That's important to note that it's responses to those health problems, not the health problems themselves. We're dealing with those patients' responses to those health problems through our nursing process. So we use the process to enable nurses to help patients meet agreed-on outcomes for better health. And then if we look at figure 15-5, or 15-2, 5-step nursing process model, it'll show you this model. And so, of course, we start with our assessment in our nursing process. That's the first step of the nursing process. We assess our patient, we gather data, and then we write our nursing diagnosis. We're not diagnosing that they have whatever, COVID-19. We're diagnosing the problems that they have. Maybe they're having dyspnea because they have COVID-19. Or maybe they're having anxiety because they think they have COVID-19. And so we're going to deal with the anxiety and trying to help them to deal with that anxiety. Not necessarily the disease itself, but simply their response to it. And then we're going to plan how we're going to do it. And then we're going to implement that plan. And then we're going to evaluate how well it worked. So that's how we're going to use our nursing process after we've assessed our patient and made a nursing diagnosis of what's going on with them. We'll have anxiety related to belief that they have COVID-19 as evidenced by patient states. They're certain they have it. And then that's what we're going to do. So, as a critical thinking model for clinical decision making, some of the components of this model. Specific knowledge base. The ability to critical think, improve clinical practice, and decrease errors in clinical judgment are aimed at aims of nursing practice. Learning to apply each element of this model in a way you think about patients will help you become a more confident and effective professional, which is very true. Excuse me. So specific knowledge base. Knowledge prepares you to better anticipate and identify patient problems by understanding their origin and nature. And Nurse Killian talked about that having that knowledge base is very important to you in order to be able to understand what you're dealing with. And not just all of your nursing base, but it includes things like information and theories from basic sciences, humanities, behavioral sciences, and nursing. That's where we have you take all of those classes. You have a broad range in your education. It's because you need that broad range. We want to remember that we're trying to care for our patients holistically with their problems. That means the whole patient, not just a disease. We're treating the whole patient. We have to think emotionally, physically, spiritually, everything, even community. We have to remember that. Then when we look at experience, well, you guys will be getting experience as you move through your nursing program, and you'll be getting clinical experience. And even if you're working out in the field, you're getting experience. It's just that your experience will change as you move as an RN. You move up and you see more of the picture. If you're a CNA, you see a smaller part of the picture. If you're an LPN, you see a slightly bigger part of the picture. When you're an RN, you see a bigger part of the picture. And so that's just a scope. Your scope changes as you move up. But you still will have clinical experience. So clinical experiences are necessary to acquire clinical decision-making skills. That knowledge combines with clinical expertise from experience and defines critical thinking. So you may have a lot of hands-on experience if you're a CNA, or a lot of hands-on experience and some decision-making if you're an LPN, and then you'll move up and get more clinical expertise and as you become an RN, and you'll with your experience, you begin to understand those clinical situations, and there's different clinical situations, and anticipate and recognize cues of patients' health patterns, and interpret cues as relevant or irrelevant. And then that's what we always tell students is, as you move up into your new role, you have to learn to shift your focus and change your decision-making model. So sometimes it's hard because you slip back into your old patterns because they're comfortable. So in a lot of ways, it's more difficult for somebody who's moving from CNA or MA or LPN into this new position. But your old experience can inform you and help you as you move and change those things. And so it can be good. It can be good experience. You just have to remember that you got to change the way you're looking at making your decisions. And then the nursing process competency. You will apply critical thinking components during each step of the nursing process. And the nursing process, people go, I don't want to do that. It's so hard. Why do I have to do this? But the nursing process gives you a formula. It gives you this component to work through that allows you to learn how to critically think. So being competent with it, each step of that nursing process will take you through and allow you to do the nursing process. Oops. Attitudes for critical thinking. 11 attitudes define the central features of a critical thinker and how successful critical thinkers approach a problem. Confidence or belief in oneself. Thinking independently, considering other ideas and concepts before forming an opinion. Fairness, justly dealing with a situation. Responsibilities and accountability, knowledge that you are accountable for your decisions, actions, and critical thinking. Risk-taking leads to advances in care. Discipline misses few details, is orderly or systematic when collecting information. Perseverance, determination to find effective solutions. Creativity, finding solutions outside of standard routines of care while following advanced standard practice. Curiosity, asking why and what if. Integrity, questioning and testing their own knowledge and beliefs. And humility, admitting limitations in knowledge and skills. If you look at table 15-3, critical thinking attitudes and applications in nursing practice, you can find that there. And then professional standards for critical thinking refer to ethical criteria for nursing judgment and evidence-based criteria used for evaluation and criteria for professional responsibility. Excellent nursing practice is a reflection of ethical standards. Nurses routinely use evidence-based criteria to assess patients' conditions and determine the efficacy of nursing interventions. So it's very important that we maintain our professional standards and that we keep them in mind when we're doing critical thinking. It's important to keep those standards. It's important to meet those standards. No matter what the problem is, we always have to think about, yes, but are we still meeting our standards? And so that becomes very important. So back to our case study. We're here again, and we've got Carla. She knows that Mr. Ramirez is not likely to be in pain because he is reluctant to move and take part in any activity. He's likely to be in pain because he is reluctant to move. Her options include conducting a thorough pain assessment and learning how Mr. Ramirez feels about pain. She must also be culturally sensitive and consider how Mr. Ramirez's Hispanic heritage may influence his responses to pain. Carla will then take what she learns and use pain control therapy Mr. Ramirez will be likely to accept. So, do you think Carla is following the nursing process? So, Think about that. Do you think Carla is following the nursing process? Let's talk about that. Okay, so when Carla notices Mr. Ramirez is slow to respond to her questions, grimaces when shifting weight on his back, and is reluctant to have a bed bath, her critical thinking leads to the inference that Mr. Ramirez is in pain. Carla decides to assess the situation more thoroughly by asking Mr. Ramirez specific questions about his comfort, such as, tell me if you are hurting, show me where the pain is located, and is this pain you have felt before? So you think about what Carla notices about Mr. Ramirez and what Carla infers from his behavior. And how does Carla's decision to ask Mr. Ramirez specific questions fit with your understanding of clinical decision making? What of the 11 attitudes that we covered would you say Carla is exhibiting? So think about that. And then before Carla begins her questions, she repositions Mr. Ramirez to make him more comfortable. As she does so, she observes an area of redness over his left heel. Redness could be due to inflammation or pressure on the skin. Carla palpates the area and notices that it is tender to touch and warm. She asks Mr. Ramirez if he has been moving his leg much, and he says, "No, I haven't. I'm afraid it will hurt my other leg." These initial findings imply that excess pressure is being applied to the heel. So what discovery does she make? What knowledge does Carla possess that helps her in this part of the assessment? And we know that every patient a nurse cares for will not have the exact same health status and need. How does a nurse prepare to meet the challenges of each new patient's care needs? Oh, it's quiz. So, the use of diagnostic reasoning involves a rigorous approach to clinical practice and demonstrates that critical thinking cannot be done. And which one is it? I won't tell you. So you pick. Okay, on to the next one. So Carla, here we go with Carla again. Carla gently applies pressure to the area with her finger and notes that after pressure is released, the area does not blanch or turn white, a key sign of excess pressure. She thinks about what she knows about normal skin integrity, the effect of immobility, and the effects of pressure on the skin. The information she collects leads her to determine that Mr. Ramirez has an early-stage pressure ulcer. The nursing diagnosis would be impaired skin integrity. How would you rate Carla as to her competency at each step of the nursing process? And Carla is clearly showing curiosity. What other attitudes and competencies is Carla displaying and employing? So Carla continues to gently encourage Mr. Ramirez to describe any symptoms or sensations that he is experiencing. He tells Carla that he does have pain in his stomach. Carla asks him to place his hand over the area of discomfort. Mr. Ramirez places his hand over the lower right quadrant of his abdomen. On a scale of 0 to 10, Mr. Ramirez rates his pain at a 7. Carla inspects the area more closely and palpates gently over the abdomen for the presence of tenderness. She notes that the abdomen feels very tight. Do you think Carla anticipates this latest information about Ramirez? Anticipated. How important do you think it is for the nurse to be adaptable? What do you think Carla will do next? What intellectual standards did Carla apply when she asked Mr. Ramirez to rate his pain? That's a good question. Okay, let's see what the next slide says. So, critical thinking synthesis. So here we are. Critical thinking is a reasoning process by which you reflect on and analyze your thoughts, actions, and knowledge. As a beginning nurse, it is important to learn the steps of the nursing process and incorporate the elements of critical thinking. If you look at figure 15-3, the synthesis of critical thinking with the nursing process competency, you will see how that is incorporated all together. And you're basically putting critical thinking and the nursing process together, and you're using critical thinking within the nursing process, synthesizing the two to do this decision making about your patient. So as far as developing critical thinking, and Nurse Killian really did go over some of this, reflective journaling. Reflective journaling can be really good. If you're a journaling person, some of us start the journals and never write in them. Reflective journaling is a tool for developing critical thinking by clarifying concepts. A lot of these concepts are embedded in day-to-day clinical situations and problems that you face. Tips for exploring clinical experience include: which experience, situation, or information in your clinical experience is confusing, difficult, or interesting? What is the meaning of the experience? What feelings did you have? What feelings did your patients or family have? What influenced the experience? Do the feelings, guesses, or questions remind you of any experience from the past or something that you think is a desirable future experience? How does it relate? What are the connections between what is being described and what you have learned about nursing science and theory? These are some things that you should put into your journal in order to help you to make them very useful to you. So that's one of the things that they recommend if you're doing reflective journaling. As far as meeting with colleagues, discussing and examining work experience and validation, nurses depend on others to help them think like a nurse. The way to develop critical thinking skills is to meet regularly with your colleagues, mentors as well. If you have a mentor who's been in nursing longer, who you can meet with to discuss your experiences with, that's a really good thing. Faculty members, preceptors, to discuss and examine work experience and validate decisions. Connecting with others will help you to learn that you do not need to know everything because support is available from your colleagues. And then concept mapping, which students all groan when you say concept mapping. But concept mapping is a nonlinear picture of a patient used for comprehension and care planning. The primary purpose of concept mapping is to better synthesize relevant data about a patient, including assessment data, nursing diagnosis, health needs, nursing interventions, and evaluation measurements. Mapping organizes and connects information in a unique way so the diverse information that you have about a patient begins to form meaningful patterns and concepts. Basically, it's a visual representation of the patient problem and interventions that shows their relationship to one another. You write them down on a piece of paper and you make lines and connections, how they connect to each other. That's what concept mapping is. And for people who are very visual, concept mapping is wonderful to learn critical thinking. You put your patient problem in the middle and you draw lines. This goes to here and this goes to there, and here this problem goes to this intervention, and this intervention connects to these things. And concept mapping can be wonderful for those of you who are very visual. Kind of unlike this, but it's okay. So, managing stress. We've talked about managing stress in nursing a couple of times. And the work of nursing is difficult. Seeing patients endure suffering that you can't stop. Painful therapies that you can't help with. Managing care responsibilities. And as we mentioned earlier, you take not only the responsibility of the patient getting better, but you also take the responsibility that your decision was wrong. It makes it very stressful. Stress over prolonged periods can make you sick. It can lead to poor work productivity, impaired decision-making and communication, reduced ability to cope with clinical situations. So we know that autonomic control of decision-making, error detection, speech, memory, and emotions during stressful situations are disrupted because of continued sympathetic nervous system stimulation. Research shows that the stress of working 12-hour shifts, for example, impairs medical judgment in part because of the way stress affects attention. So it is so important that nurses manage stress. If you look at box 15-5, impact of stressful work environments on thinking and decision-making, that's got some useful information there that you can see about managing stress. But we have to keep stress in mind, that it does affect our ability to make good decisions and to do good critical thinking. So we have to know, because everybody responds to stress differently, we have to make sure we know about our own stress management. Here's another quiz. So nursing process organizes your approach while delivering nursing care. To provide the best professional care to a patient, nurses need to incorporate nursing process and... which one of these? They might all be good, but one is gooder. So, I'm not going to tell you. So back to our case study. One more time. And here is Carla. Carla does what she can to position Mr. Ramirez more comfortably and make sure his leg discomfort is under control. She knows that the increased pain and tightness he is experiencing suggests that something is causing pressure in the abdomen. It could mean the patient is having bleeding from his bruised liver. Carla decides to call Mr. Ramirez's physician immediately. So what critical thinking competencies did Carla's thought that Mr. Ramirez has pressure developing in his abdomen? What knowledge did Carla apply in this clinical situation? Do you think Carla made the right decision, and why? And that is the end of chapter 15.